So, good evening, one and all. I'm Parishmita. Uh, I'm an alumni of RGNIYD and presently I'm a research scholar of University of Delhi. So, I'm going to present about youth suicide in India, uh, a growing a growing threat. So this is the outline of my presentation. In this presentation, I am going to focus about the trends of youth suicide in India, as well as causes and risk factor associated with this youth suicide. Though youth suicide is a problem which prevalent worldwide, but in this presentation, I am focusing on the youth suicide in India. So we all know that suicide is a significant public health concern across the globe, which takes lives of more than 7 lakh people every year. It's the data given by WHO. More than 1 in every 100 deaths, that is 1.3% in 2019, were the result of suicide. And it's the data given by Suicide Worldwide in 2019. Suicide occurs throughout the lifespan, and it was the fourth leading cause of death among 15 to 19 years old globally in 2019 for both sexes after road injury, tuberculosis, and interpersonal violence. Here, in my presentation, for data regarding worldwide for data regarding suicide among youth in the world is available till 2019. So I am giving data till 2019, and in case of India, data available on suicide for 2020. So for Indian perspective, I'm providing data till 2020. So Vishal, please move to the previous slide. Yeah, so the majority of death by suicide occurred in low and middle income countries, including India, where most of the world population live. A total of 1,53,052 suicides were reported in the country. Like in India during 2020, showing an increase of 10% in comparison to 2019, and the rate of suicide has increased by 8.7% during 2020 over 2019. In this year, rate of suicide is increasing more than the previous years. It might be because of the COVID-19 pandemic and the problems created by this pandemic. So even though like in India suicide rates are high, but the age group which comes like 18 to 29 years, whom we considered as youth according to National Youth Policy, was the most vulnerable groups resorting to suicides. This age group alone accounted for 34.4% of suicides to the total population of youth suicide in India. Please move to the next slide. For this paper, I am focusing only on secondary data. So the data which I have taken, it's mainly from government reports, that is National Crime Record Bureau's accidental death and suicide in India from 2015 to 2020, and another report given by National Crime Record Bureau, that is Crimes in India. Moreover, I am focusing on different research article and different official websites, like websites of WHO, websites of Government of India, and all these things. So this paper is fully based on secondary data. So now I am coming to the trends of youth suicide in India. So here I am giving data from 2015 to 2020. If we see this data, then we can see that from 2015 to 2016, the total cases of youth suicide that is it's reduced. The number of total youth suicide is reduced, but the rate of youth suicide to the total cases of suicide, it's increased from 32.8% to 33%. And from that year, from 2016 to 2020, it's increasing for all years. Like rate of suicide to total cases is increasing from 33% to 35% till the year 2019. And one good symptom which we can analyze this in the year 2020, the rate of youth suicide is comparatively less than the previous year, that is 2019. But the scaring thing is that the total cases of youth suicide in India in 2020 has crossed the limit of 50,000, and it reached 52.718. Like in every year, like in 2020, more than 50,000 youth died only because of suicide. So these things we need to give an importance. So next slide. Yeah. So when we see the causes of youth suicide in India, then there are many causes for which youth committed suicide, but the family problems is the major cause, like for which most of the youth, that is 17,754 youth died only because of these family problem issues, like family problems. They have committed suicide because of family problems. But in case of female, like if we see the data for female, then we can say that 2,600.
Your time is up. Please conclude in next 2 minutes.
Okay. So, like for female, marriage-related issue is the major cause for suicide, and for transgender person, illness is the major cause for suicide in India. Please move to the next slide. So there are different risk factors which are associated with suicide, especially suicide regarding suicide for youth. These are the social and family risk factors: social disadvantage, parental separation and a divorce, like parental psychopathology. It includes depression, substance use disorders, and antisocial behaviors, family history and suicidal behaviors. Marital discord, it includes the parental disharmony and all, history of physical and sexual abuse during childhood, and parent-child relationship, which also selected as a risk factor for youth suicide in India. Please move to the next slide, please. Yeah, so like in India, there is no national suicide prevention strategy till now, but it's well demanding. We all know that to prevent suicide, a proper prevention strategy is necessary, which is missing. But the National Mental Health Policy in India launched in 2014. It aimed to reduce the deaths and suicide attempts through various means, like through various schemes under it. And there are some other national laws and programs which include National Program for Adolescents Health, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. And these are the programs. Actually, these programs focusing on the reducing the problems of mental health issues as well as problems of youth and adolescents. But these programs are especially not meant for reducing the youth suicide. Please move to the next slide. Yeah, like as social worker, what social workers can do to prevent suicide? So here I can divide this prevention strategies into two parts. First, universal prevention, preventive intervention. This prevention intervention is for all the community members, and here gatekeeper training can be an effective suicide prevention intervention, where gatekeepers are those individuals within the community who are trained to identify suicidal risk factors, so that they can help the social workers to prevent suicide and to work from them. Secondly, social workers should educate the general public on suicidal risk factors with or without the use of gatekeeper training. Thirdly, improving the diagnostic abilities of social work trainees and students. improving social work education and training with specific focus on preventing suicide can obviously strengthen social workers' diagnostic abilities, and it can help in preventing suicide among youth.
Parishmita, please conclude.
Yeah, so just 1 minute. So another preventive measures, these are selective preventive measures, and these are for those population who are at increased risk for suicide, such as those who have attempted for suicide, who are unemployed, homeless, and have psychiatric disorders. So social workers can work and can provide helping hand to those peoples, and can help them to get out of this mindset of committing suicide, and can live a better life in future. Please move to the next slide. Yeah, so these are the suggestions, immediate enactment and implementation of national suicide prevention strategies for India is the need of the hour. So government should give utmost importance in this regard. Secondly, focus should be given on proper implementation of mental health programs. These programs are implementing, but there are some challenges which are faced by the people. So these challenges should be removed and it should be properly implemented. Thirdly, government should emphasize on solving the major issues of youth, such as unemployment, poverty, etc., which stands as causes for youth suicide, with proper policy initiations. Secondly, research on suicide and other youth-related issues should be motivated by the social work educators and other teaching professionals, and this is the civil society organizations and non-governmental organizations which can play a crucial role in preventing suicides, and they can help the community members to prevent these issues from their community. Please go to the conclusions. Yeah. So we all know that suicide is a personal tragedy that permanently takes the life of an individual and has continuing ripple effect, affecting the lives of families, friends, and communities, as well as the whole nation. So suicide is preventive, and intervention provided at the right time, in the right intensity, and for the right duration can help people at risk of suicide. The enormity of suicide deaths in India calls for an immediate action. Immediate action necessitates political will, intersectional collaboration, and a commitment and community participation. In addition, a groundswell of public interest is needed to address stigma and improve social support systems and help-seeking behavior. We all know that the SDG is targeting to reduce the suicide rate. So this target of 1/3 reduction of premature mortality due to non-communicable disease is unlikely to meet globally unless suicide death is decreased in India, not at all in India, but all the low-income and middle-class countries. A public health approach at all levels to reduce suicidal deaths rapidly and substantially is urgently needed. So this is my references. I tried to go very fast, so it's all. Thank you for listening.